Hi everyone, I just wanted to give an update on how the Medic to Medic PPE Appeal has been going. For those of you that don't know me, my name's Tamsin and I'm the CEO of Medic to Medic. Now, first of all, I wanted to start off by saying a massive thank you to everyone who has donated so far. We know that this is a potentially very challenging time financially, and so it's been so heartening to see the generosity of donations that have been coming in. Some from people that we know and have been very loyal supporters and donors over the years, but also from new names of people that we haven't met before, which has been just wonderful to see how far-reaching the appeal has gone. Now, as a small charity, each donation feels really personal, and we take great responsibility in making sure that it's spent wisely and is spent how we say that we're going to spend it. So this is why I wanted to update you a little bit on how things have been going. So when we first started out this project, we thought that a realistic fundraising total would be around about £5,000, but as things have evolved globally, as the design of the kits and what items have required has changed slightly, there was also going to be a lockdown in Malawi about 10 days ago. Unfortunately, that hasn't gone ahead, but it still had a knock-on effect on prices. So we had to revise our fundraising total to £8,000, and with that we can provide all the necessary items and the PPE kits to 126 graduates. And what's amazing is that we've reached that target, which has been absolutely incredible, and we still have a week or so to go of the appeal. So now we're moving on to the next phase, and we're increasing our target to £10,500. So with this extra target, we'll be able to provide 126 graduate health workers with a really modest allowance of £20. And we feel that that allowance is actually really important because it will enable the graduates to replace items such as soap and hand sanitizer and gloves and masks when they run out. And we know that there's some variation between salaries. Some of our alumni community have been health workers for over 10 years and others have only just recently graduated. So we know that the ones that are still doing their internships do not have the same resources as our graduates who've been health workers for a long time. So we wanted to make sure that every one of them had an allowance that they could draw on for replacements should they need to. Now, we've put in all the orders for the PPE kits. Actually, we've got most of the items and collected most of the items. Our Mazuzu graduates should be receiving their kits within the next few days. The Lilongwe and Blantyre graduates, they're waiting for their scrubs to be finished at the tailors, and they should be ready within the next 7 to 10 days. And our plan is that if we raise more than £10,500, is that then we can commission more PPE items, which will be distributed back to Malawi's government hospitals and facilities. And what's really fantastic is that some of our graduates are actually on the COVID-19 task force in Malawi, and so they know where the shortfalls are, they know what PPE they need and what's required. So we'll be working very closely with them to identify what extra resources we may be able to contribute to. Our hope is that we'll be using some of our gift aid money from the donations raised through this appeal to go towards commissioning extra PPE as well. So just on that note, if any of you do want to gift aid your donation, which would obviously be wonderful, please just drop us an email at info@medictomedic.org.uk. I'm already aware of some donors who've already emailed us and said that they want to do that, so if you've done so already, you don't have to email again. But for those of you that haven't informed us, then please just drop us an email and we'll make sure that that gets done. Now, in terms of how COVID-19 is affecting our graduates, there are 2 graduates that we know of that have already been exposed to COVID-19 in the line of duty. One of them was tested negative after being in 2 weeks of quarantine at the weekend, and which is great, obviously very happy news for her. Our other graduate has some time before they're at the 2-week mark, so obviously it's quite a distressing and anxious time for them. It's obviously an anxious time, as we're all aware, and distressing time for health workers globally, and everyone is doing an incredible job. But Malawi, I feel, they don't have enough health workers as it is at the best of times. So we really hope that through these PPE kits we can work together with them and really help protect the ones that they already have, so that they're there to keep working and helping their people for longer. We would obviously be devastated if anything happened to any of them. Trying to end on a positive, of which there are many positives in this appeal. It's been a really fantastic journey working with all the tailors and street vendors, graduates and the volunteers on the ground to get this project together. Obviously it doesn't happen in isolation. We couldn't pull off this appeal or do this campaign without all of them together. But we also obviously couldn't do it without your really kind donations. And all the donations that you give are being spent in Malawi, so we're helping local businesses, supporting local people, increasing infrastructure in the country so that they can respond to their own pandemic response and provide PPE to their own health workers. There's obviously some bank charges in terms of international transfers for monies to reach Malawi, but we can guarantee that all the money donated through this appeal will be spent in Malawi, and the PPE provided will go to graduates in Malawi. So thank you so much for supporting us. Thank you for supporting our graduate health workers. If you are able to keep updated on the crowdfunder, please do so. We're trying to be really proactive in keeping it updated with all the updates, so that you can see what's going on and how we're already using some of the donations. If you have any other questions, or you want to get involved in some way, or you have a contact which you think may be useful for us, then please do email us. We'd love to hear from you, and we're very keen to work with anyone who may be interested in getting involved. So our email address is info@medictomedic.org.uk. Obviously, if anyone knows of a church group or a work group who wants to donate their coffee morning money, that would be wonderful. Just drop us an email as well. But until next time, and I will be updating you in the future about how the campaign has gone, and all the special thank yous to everyone who's made it happen. Until next time, stay safe.